every day. Over 1 million sexually transmitted infections are acquired according to the WHO. More than 1 million sexually transmitted infections (STIs) are acquired every day worldwide. Each year, there are an estimated 357 million new infections with one of 4 STIs: chlamydia, gonorrhea, syphilis and trichomoniasis. More than 500 million people are estimated to have genital infection with herpes simplex virus (HSV. More than 290 million women have a human papillomavirus (HPV) infection. 1. The majority of STIs have no symptoms or only mild symptoms that may not be recognized as an STI. STIs such as HSV type 2 and syphilis can increase the risk of HIV acquisition. Over 900,000 pregnant women were infected with syphilis, resulting in approximately 350,000 adverse birth outcomes, including stillbirth. Indiana, 20122. In some cases, STIs can have serious reproductive health consequences beyond the immediate impact of the infection itself, e.g., infertility or mother-to-child transmission. Drug resistance, especially for gonorrhea, is a major threat to reducing the impact of STIs worldwide. More than 30 different bacteria, viruses and parasites are known to be transmitted through sexual contact. 8 of these pathogens are linked to the greatest incidence of sexually transmitted disease. Of these 8 infections, 4 are currently curable: syphilis, gonorrhea, chlamydia and trichomoniasis. The other 4 are viral infections and are incurable: hepatitis B, herpes simplex virus (HSV) or herpes, HIV, and human papillomavirus (HPV. Symptoms or disease due to the incurable viral infections can be reduced or modified through treatment. STIs are spread predominantly by sexual contact, including vaginal, anal and oral sex. Some STIs can also be spread through non-sexual means such as via blood or blood products. Many STIs, including chlamydia, gonorrhea, primarily hepatitis B, HIV, and syphilis, can also be transmitted from mother to child during pregnancy and childbirth. A person can have an STI without having obvious symptoms of disease. Common symptoms of STIs include vaginal discharge, urethral discharge or burning in men, genital ulcers, and abdominal pain. STIs have a profound impact on sexual and reproductive health worldwide. More than 1 million STIs are acquired every day. Each year, there are estimated 357 million new infections with one of 4 STIs: chlamydia 131 million, gonorrhea 78 million, syphilis 5.6 million and trichomoniasis 143 million. More than 500 million people are living with genital HSV herpes infection. At any point in time, more than 290 million women have an HPV infection, one of the most common STIs. STIs can have serious consequences beyond the immediate impact of the infection itself. STIs like herpes and syphilis can increase the risk of HIV acquisition threefold or more. Mother-to-child transmission of STIs can result in stillbirth, neonatal death, low birth weight and prematurity, sepsis, pneumonia, neonatal conjunctivitis, and congenital deformities. Over 900,000 pregnant women were infected with syphilis, resulting in approximately 350,000 adverse birth outcomes, including stillbirth. Indiana, 20122. HPV infection causes 528,000 cases of cervical cancer and 266,000 cervical cancer deaths each year. STIs such as gonorrhea and chlamydia are major causes of pelvic inflammatory disease (PID) and infertility in women. Counseling and behavioral interventions offer primary prevention against STIs, including HIV, as well as against unintended pregnancies. These include comprehensive sexuality education, STI and HIV pre- and post-test counseling, safer sex risk reduction counseling, condom promotion interventions targeted at key populations, such as sex workers, men who have sex with men and people who inject drugs, and education and counseling tailored to the needs of adolescents. In addition, counseling can improve people's ability to recognize the symptoms of STIs and increase the likelihood they will seek care or encourage a sexual partner to do so. Unfortunately, lack of public awareness, lack of training of health workers, and long-standing, widespread stigma around STIs remain barriers to greater and more effective use of these interventions. When used correctly and consistently, condoms offer one of the most effective methods of protection against STIs, including HIV. Female condoms are effective and safe, but are not used as widely by national programs as male condoms. Accurate diagnostic tests for STIs are widely used in high-income countries. These are especially useful for the diagnosis of asymptomatic infections. However, in low- and middle-income countries, diagnostic tests are largely unavailable. Where testing is available, it is often expensive and geographically inaccessible, and patients often need to wait a long time or need to return to receive results. As a result, follow-up can be impeded and care or treatment can be incomplete. The only inexpensive, rapid tests currently available for STIs are for syphilis and HIV. The syphilis test is already in use in some resource-limited settings. The test is accurate, can provide results in 15 to 20 minutes, and is easy to use with minimal training. Rapid syphilis tests have been shown to increase the number of pregnant women tested for syphilis. However, increased efforts are still needed in most low- and middle-income countries to ensure that all pregnant women receive a syphilis test. Several rapid tests for other STIs are under development and have the potential to improve STI diagnosis and treatment, especially in resource-limited settings. Effective treatment is currently available for several STIs. 3 bacterial STIs, chlamydia, gonorrhea and syphilis, and 1 parasitic STI, trichomoniasis, are generally curable with existing, effective single-dose regimens of antibiotics. For herpes and HIV, the most effective medications available are antivirals that can modulate the course of the disease, though they cannot cure the disease. For hepatitis B, immune system modulators, interferon and antiviral medications can help to fight the virus and slow damage to the liver. Resistance of STIs, in particular gonorrhea, to antibiotics has increased rapidly in recent years and has reduced treatment options. The emergence of decreased susceptibility of gonorrhea to the last-line treatment option, oral and injectable cephalosporins, together with antimicrobial resistance already shown to penicillins, sulfonamides, tetracyclines, quinolones and macrolides, make gonorrhea a multi-drug-resistant organism. Antimicrobial resistance for other STIs, though less common, also exists, making prevention and prompt treatment critical. Low- and middle-income countries rely on identifying consistent, easily recognizable signs and symptoms to guide treatment, without the use of laboratory tests. This is called syndromic management. This approach, which often relies on clinical algorithms, allows health workers to diagnose a specific infection on the basis of observed syndromes, e.g., vaginal discharge, urethral discharge, genital ulcers, abdominal pain. Syndromic management is simple, assures rapid, same-day treatment, and avoids expensive or unavailable diagnostic tests. However, this approach misses infections that do not demonstrate any syndromes, the majority of STIs globally. Safe and highly effective vaccines are available for 2 STIs, hepatitis B and HPV. These vaccines have represented major advances in STI prevention. The vaccine against hepatitis B is included in infant immunization programs in 93% of countries and has already prevented an estimated 1.3 million deaths from chronic liver disease and cancer. HPV vaccine is available as part of routine immunization programs in 65 countries, most of them high and middle income. HPV vaccination could prevent the deaths of more than 4 million women over the next decade in low- and middle-income countries, where most cases of cervical cancer occur, if 70% vaccination coverage can be achieved. Research to develop vaccines against herpes and HIV is advanced, with several vaccine candidates in early clinical development. Research into vaccines for chlamydia, gonorrhea, syphilis and trichomoniasis is in earlier stages of development. Other biomedical interventions to prevent some STIs include adult male circumcision and microbicides. Male circumcision reduces the risk of heterosexually acquired HIV infection in men by approximately 60% and provides some protection against other STIs, such as herpes and HPV. Tenofovir gel, when used as a vaginal microbicide, has had mixed results in terms of the ability to prevent HIV acquisition, but has shown some effectiveness against HSV too. Despite considerable efforts to identify simple interventions that can reduce risky sexual behavior, behavior change remains a complex challenge. Research has demonstrated the need to focus on carefully defined populations, consult extensively with the identified target populations, and involve them in design, implementation and evaluation. People seeking screening and treatment for STIs face numerous problems. These include limited resources, stigmatization, poor quality of services, and little or no follow-up of sexual partners. In many countries, STI services are provided separately and not available in primary healthcare, family planning and other routine health services. In many settings, services are often unable to provide screening for asymptomatic infections, lacking trained personnel, laboratory capacity and adequate supplies of appropriate medicines. Marginalized populations with the highest rates of STIs, such as sex workers, men who have sex with men, people who inject drugs, prison inmates, mobile populations and adolescents, often do not have access to adequate health services. Source: WHO.
Thank you for watching. Don't forget to subscribe to receive new video.